Hello and welcome to Health Matters once again on Channels Television. We are so glad you could join us because today we're discussing something that should concern everybody, the health of children. Pneumonia is considered to be the single largest cause of death by infection in children globally. According to the World Health Organization, 15% of all deaths in children under the age of 5 are caused by pneumonia. 992,000 children were lost to it in 2015. This disease affects children and families all over the world, but South Asia and Sub-Saharan Africa are the worst hit. My guest on the show today is Dr. Ayodele Rena. Dr. Rena is a senior registrar in pediatrics at the Lagos University Teaching Hospital, Idi-Araba. You're welcome to the show.
Thank you very much, Mary, for having me yet again.
Now, this pneumonia, it's different from the common cold, isn't it?
Yes,
how do you describe pneumonia?
Okay, so in terms of definition, a pneumonia can be defined as an infection, an inflammation of the distal airways. When I say distal, it means the airway, the part of the airway that is close to where the gaseous exchange takes place. What I mean by that is that the lungs and our airways are the things that help us to breathe and help us to use the oxygen to do everything that we need to do. So when a bug gets into the airways and infects the part that actually does the gaseous exchange, that is a pneumonia, as opposed to a common cold, which would just probably affect the nose and then the throat. But the pneumonia goes really far down into the lungs.
Right to the end of the lungs, right, those little alveoli.
The alveoli. You've done your research.
All right. So what causes it? You've called it a bug. Does this bug have a name, or is it bacterium? Is it virus? What is it?
Well, what I'd like to say is that children are not many adults. Children have their own unique physiologic differences from adults, and so children at different phases of life would have different bugs or organisms that could cause pneumonias. For instance, the newborn children, babies who are born and who are in the first 28 days of their lives, would have what we call gram-negative organisms. Now, these organisms are organisms that are gotten from the digestive tract of the mothers.
Okay, but those are bacteria, right?
Those are bacteria. They are bacteria. And you find out that if you took a survey of all the children, the most likely organism causing pneumonias would be viruses. So viruses are the most commonly implicated, such as respiratory syncytial virus, influenza virus, parainfluenza virus. However, organisms or bacteria like Streptococcus pneumoniae and chlamydia pneumoniae are very well implicated in the development of pneumonias in children across all ages.
So far, bacteria and viruses. Would cause. How do they get into the child's lungs?
Primarily, the access to the child's lungs or respiratory tract is through droplet infections. For instance, if somebody here has a pneumonia and coughs, he releases what we call droplets, and they are really, really micro sort of packets that contain these bugs, and these bugs are inhaled by the children, and the bugs get into the respiratory tract and all the way down to the alveoli. Sometimes, although it's not usual, there is an infection elsewhere in the body. For instance, maybe an osteomyelitis or an infection of the bone, an infection of the throat, and then the bug now finds its way from the throat or from that distant site to the lungs, because the lungs is really well bathed in blood. But primarily, it really is a droplet infection.
But these infections that they get from the throat, maybe the nose, isn't there always bacteria present there anyway? So it's, very risky.
Yes, Mary, I agree with you. Bacteria is present even on our skin. And what we call those bacteria that are present on us without causing harm is normal flora or commensals. Now, what they do there is that, just like you and I, bacteria, they just want to survive. They just want to eat. They just want to make sure they're alive. And so the commensals are just there. They don't really harm you. As a matter of fact, it's been proposed in some circles that normal flora or commensals actually fight off harmful bacteria, because you can't expect somebody to come to your house and try to take over and you won't give them a fight. So the normal flora do sometimes actually fight off the pathogenic.
They are the owners of the space.
They are the valleys.
All right. Now, children, are they most at risk? Or are there other, groups of people also who are most at risk of getting pneumonia?
Children are particularly susceptible to developing pneumonias because of their immune system. So the immune system is a little bit naive, and what the immune system requires to build a sort of memory is repeated stimulation. And so with children, especially the newborn babies, a lot of their immune mechanisms, the ability for them to cough, the ability of their immune system to actually mount a response to fight off the bacteria is actually significantly impaired just because they are fresh out of the womb. Also, children who are immunocompromised, for instance, children who are malnourished, they are more at risk of developing pneumonias. Children who have HIV, children who are
we're talking about the risk factors now.
Yes, the risk factors now. So children who have HIV, children who are malnourished, children who were not exclusively breastfed, and so one cannot overemphasize the importance of exclusive breastfeeding for the first 6 months of life. So also children who are on things like cancer, chemotherapy, children who are immunocompromised in any way are more at risk of developing pneumonias than children who are healthy. Also children who have underlying cardiac diseases and underlying lung abnormalities are more at risk of developing pneumonias than healthy children.
What on earth is in that breast milk?
Well, I would say it's a magic potion.
Wow.
It is a magic potion. Breast milk contains a lot of factors such as antibodies. It contains some biochemical factors that they call lactoferrin, produced by Lactobacillus bifidus. And lactoferrin is a very potent antimicrobial. And
well, since you know the names, can't they formulate something that is exactly like it?
They have tried for decades and they have not been able to come up with the exact formulation in terms of protein to carbohydrate ratio, in terms of the antibodies present in breast milk. So man can keep trying. I'm not sure we'll get there.
So breast milk it is?
Breast milk it is.
Now, what would someone complain of, someone who is suffering from pneumonia?
Okay. Yet again, children, in terms of their presentation when they have a pneumonia, would present based on how old they are. So for the newborn who can't complain or cry, he'd have things like feeding difficulty, he'd have things like clear, obvious difficulty with breathing, he'd have things like just general malaise and general lethargy. But for older children who can't complain, there'll be chest pain, there'll be cough, there'll be difficulty with breathing, there'll be poor feeding, possible vomiting, and sometimes if it's really severe, you can just see them turn bluish because they're not getting enough oxygen.
We are black people. Does a black baby turn blue?
Well, if I talk now strictly about babies, a lot of babies come out pink.
That's true.
I have hardly ever seen a Nigerian baby that comes out black. They're really nice and pink. And so when they begin to turn blue, you can actually, even if the baby is quite dark, the hands, how black can the hands be? So the hands are actually, the place that you should look at, the hands, and then the mouth, the lips. Yes, and the lips give you, and under the tongue or the buccal mucosa, that's inside the mouth. They give you a fairly good indication of the fact that the child is actually turning blue.
When you talk about difficulty with breathing, what would the breathing be like?
Okay, so
because the parent has to know that this child is having difficulty. If the child cannot say, it's difficult for me to breathe.
Yes. In my experience, what I have found is that mothers are probably the best doctors there are. So a mother would tell you that, look, this child yesterday, he was breathing absolutely fine. And today, I find out that he's breathing fast, so mothers would immediately recognize that the breathing suddenly has just become faster than it was the previous day. And you suddenly realize that the chest just keeps on going in. And nobody that is breathing that quickly or with that much difficulty will be able to feed. So they also reduce the amount that they are sucking, and they're just unable to suck. And she's wondering why. And she undresses the child and she realizes that, so this chest is going in too much, and that alerts her to present.
A caved-in chest.
The chest just keeps going. They call it chest indrawing. So the lower part of the chest just keeps going. And so there's this a little bit of indrawing under the ribs, and the mother immediately presents.
Okay, what factors would come together for prevention of pneumonia?
Prevention is extremely essential, extremely critical. Now, in terms of primary prevention, first of all, health education is absolutely essential, which I give you 2 thumbs up for doing, in terms of, because this is one of the means by which the public is educated about the fact that pneumonias are real and pneumonias do cause death in children. Another fact, second most common cause of death after issues relating to preterm deliveries. Now, so talking specifically about prevention, apart from health education, vaccination, immunization is very, very essential. And so there are vaccines against the common bacterial organisms that cause pneumonia. Then
let me stop you there for a moment. We'll come back and continue on prevention.
No problem.
But we really need to go on a break. We'll take a short break and be back right after. Please stay with us.